Hello everyone. So we are going to continue with our topic of discussion, which is poliomyelitis, and we are going to continue on bulbar paralytic polio. In the last video, we have talked about symptoms of spinal paralytic polio. So now in this video, we are going to talk about bulbar paralytic polio, then bulbospinal paralytic polio, and then the diagnosis, then management and prevention and whatsoever. So that is it. Then in bulbar paralytic polio, actually, from the word bulba, it is derived from the word bulb, actually. Bulb in neurology means brainstem, and specifically medulla oblongata. So, what do you think if this if this poliovirus enters into the medulla oblongata and damage it? We have already know that in the medulla oblongata, it is the one that is controlling our swallowing, right? Because it is in there we are having a kind of glossopharyngeal nerve. Glossopharyngeal nerve, it emerges also from the medulla oblongata. It controls our some muscles in the pharynx actually, and that muscles of the pharynx they are actually involved in what in swallowing. So if this medulla oblongata is damaged, the nucleus of this glossopharyngeal nerve will also going to be damaged actually. So if this glossopharyngeal nerve is damaged, then definitely swallowing reflex will going to be impaired. If swallowing reflex or if swallowing is impaired actually, then definitely we have that is swallowing impairment. So what is the consequence of swallowing impairment is you cannot swallow even saliva. So if a person cannot swallow saliva, then definitely the saliva will accumulate in his oral cavity, then going to enter into his air passage, and then leading to suffocation actually. So that's another. This is important consequence also, and also the damage of this medulla will also affect his breathing. Will going to affect his respiratory rate, respiratory rhythm, and depth of the respiration, right? Because medulla oblongata also help us to have a kind of breathing, actually, spontaneous breathing, right? So that is it. And also, some nerves are going to get damaged, vagus nerve. And we have already known that this vagus nerve supplies a lot in our body. Let's say specifically to heart. So if this vagus nerve is damaged, then definitely we are going to have a kind of heart problem specifically, most importantly. Why? Because the vagus nerve is the one that it is among the one that is controlling the heart rate the rate of the heart, right? And then the rhythm. Why? Because vagus nerve gives a kind of parasympathetic innervation to the heart. So without parasympathetic innervation to the heart, then the heart will going to have a kind of faster heart rate, right? Abnormally faster heart rate. So whatsoever that symptoms of and other symptoms of vagus nerve damage, and we have to know that this vagus nerve it is the one that is inhibiting some kind of uh, salivary glands, specifically the parotid gland actually. So without this, the parotid gland will going to have denervation of parasympathetic nervous system, right? So that is it. Then now we are going to go and see the symptoms of associated with accessory nerve damage. Also, accessory nerve have kind of brainstem part and then the spinal part, right? So, if the brainstem part, that's specifically the medullary part, gets damaged, then the person cannot move. That is accessory nerve damage. Accessory nerve damage can lead to what? Impairment of neck movement. Impairment of neck movement. So that is it. Then now we are going to see the third type of paralytic polio, which is called the bulbospinal. Bulbospinal. And in bulbospinal, the upper part of the spinal cord and the lower part of this medulla oblongata are damaged by this polio virus actually. So, and in this region, it is in this region actually that is especially the cervical region we have the emerging of uh, uh, cervical plexus, and it is from the cervical plexus that we have phrenic nerve, right? So, if this area is damaged, then the phrenic nerve will going to be affected definitely. So, damages phrenic nerve damage. So if the phrenic nerve is damaged, then definitely there will going to be what? Denervation. That's there's no, the diaphragm cannot be innervated, right? That's a denervation of diaphragm. Dia, dia, how to write diaphragm, right? So that is it, diaphragm. So this is the consequence, and without innervation of the diaphragm, then definitely the patient will going to have breathing problem, right? Breathing problem. So that is it. So now let us see the diagnosis. We have come to an end of the forms of the polio. Now let us see the diagnosis. So for you to diagnose polio, or to confirm the diagnosis, you have to kind of diagnosis take, because we have a viremia stage, right, of the virus. So you have to take a kind of antibodies, measure the antibodies against the polio virus. Antibodies that detect antibodies of polio virus in the blood, right? So that is it. Then apart from that, if you are suspecting the patient is having aseptic meningitis, that's aseptic non-paralytic meningitis, then you have to take a CSF, right? That's lumbar puncture via a kind of LP. That is, let me write LP, just lumbar puncture, right? Then that is it. And then also you have to a kind of then do a kind of some physical examination, like what, like measuring deep tendon reflex and then sensory innervation, because we have to know that the limb, for example, let's say left upper limb, that's upper extremity, is affected, the extremity will going to have an intact sensory innervation. So we have to do that in physical examination, right? So in physical examination, and you will see even in from direct inspection, you will see that the muscles, that is the muscles in the extremity that is affected, will going to have a kind of atrophy, as we have already said, right? Because of denervation, right? So that is it. Physical examination will also help in the diagnosis, actually. So that is it. Then how about the treatment? How will we treat? There is no specific cure for poliovirus. No cure, actually. Only supportive. Why supportive? Because we have seen that the polio can affect breathing, right? The polio can affect breathing. So if the polio can affect breathing, we can support the patient with ventilation, right? Ventilation. Sorry about that, right? That's it. And then prevention. Prevention. So how we will prevent? How can we prevent the poliovirus infection? Is this poliovirus, for example, from the survivors of polio? Let's say a patient has contracted with polio, then the antibodies that are produced by the uh, already contracted person can be extracted from his blood and then used for passive immunity. That is, can prevent passive immunity. And this passive immunity is when you take antibodies directly from a person and then inject it to another person. That's when you give him a kind of passive immunity, because that antibodies is not produced by the immune system of the recipient, right? So that's it. And you can only get this antibody against the virus in a person who has previously contracted with the virus or has previously been injected with the polio vaccine, right? So, and also the polio can be uh, prevented by active immunization. That's active immunity. That is by giving the vaccine, right? So that is it. By giving vaccine like OPP, oral polio vaccine. Let me write it is polio, oral polio vaccine, actually. So that is it. So then the prognosis. The prognosis of paralytic polio is mostly, despite the nerves that are damaged, they can come back to normal function within, that is the damaged nerve. The damaged nerves can come back to normal to normal within 6 to 8 months, actually, in most cases of paralytic polio. And but in some cases, the paralysis may remain permanent, actually, in minority of cases. In minority of paralytic cases, the paralysis can remain permanent. It may remain permanent, actually. So that is, but in most cases, the damaged nerve can regain their function within 6 to 8 months, actually. So this is the end of this poliomyelitis lecture. Thank you very much.